In your morning medical news, the Trump administration is ordering a phase out of petroleum-based food dyes. HHS Secretary Robert F. Kennedy Jr. announced that change, part of his Make America Healthy Again initiative. These synthetic dyes, common in things like cereals, sports drinks, and snacks, are already banned in Europe and Canada, where natural alternatives are used instead.
For companies that are currently using petroleum-based red dye, try watermelon juice or beet juice. For companies currently combining petroleum-based yellow chemical and red dyes together, try carrot juice.
The FDA is hoping to eliminate synthetic dyes from the food supply by the end of next year. And American women continue to have fewer babies than in previous decades. About 3.6 million babies were born in the U.S. last year, up less than 1% from 2023's record low. The fertility rate has been declining since 2008, with experts pointing to rising childcare costs and concerns about maternal health care as key factors. It is a transitional time leading up to menopause. Right now, millions of U.S. women are going through perimenopause, which can greatly impact their lives. Despite this, some officials say research and education surrounding this stage of life and what comes after it has been overlooked and underfunded. Mandy Gaither goes over what to know about perimenopause and the symptoms that may signal a woman is going through it.
It's a natural part of aging, but a 2022 survey shows many women are going through menopause or perimenopause without knowledge or appropriate medical care. More than 90% of women in the study reported they'd never been taught about menopause in school, and more than 60% said they didn't feel informed about it at all.
I think it's really exciting, though, that for women, we are addressing and putting out there in the forefront hormonal changes that occur in the later part of reproductive life.
OBGYN Dr. Sujatha Reddy says menopause is when the ovaries stop functioning and there hasn't been a menstrual period for 12 months. Perimenopause is the time leading up to this.
What most women will experience are changes in these hormone levels leading to abnormal or irregular periods.
Reddy says other common signs include hot flashes, vaginal and sexual changes, as well as altered mood and sleep. Most women will begin the menopause transition between ages 45 and 55, but it can happen earlier or later. The average menopausal age in the U.S. is 52. The process typically lasts several years, but every body is different.
There is no exact test. There is no exact diagnosis. We tend to treat the symptoms that women are experiencing in this time.
If symptoms are disrupting your life, Reddy says to see a doctor and to be aware of companies selling an instant fix.
There is no magic wand that is going to cure every symptom you have.
Good advice there in general. And Dr. Reddy says there are several different options to help treat and relieve those symptoms, like hormone manipulations through hormonal intrauterine device, birth control pills, and some other medications that could be considered based on your symptoms. As always, talk with your doctor. Closer to home here, the Winona area saw an uptick in whooping cough cases this winter. Early stages of the sickness look like a common cold, but if left untreated, a violent cough can develop. Young children are particularly vulnerable to the infection. Health officials say cases have diminished so far this spring, but it's still important to keep an eye out for symptoms.
So what we recommend for anyone is, if they're exposed, call their healthcare provider and get the next steps. And if they do have symptoms, their healthcare provider will definitely give them some antibiotics, and I often recommend that they stay home until they completed those course of antibiotics.
And she says keeping up to date on vaccinations is the best way to prevent the infection.